This pandemic has bring a lot of effect to the whole world. The spread of coronavirus over 200 countries and U.S. states has left national economies and businesses counting the costs, as governments struggle with new lockdown measures to tackle the spread of the virus. The pandemic has negatively affected global economic growth beyond anything experienced in nearly a century. Estimates so far indicate the virus reduced global economic growth to an annualized rate of -4.5% to -6.0% in 2020. Job losses have been concentrated more intensively in the services sector where workers have been unable to work off-site. The human costs in terms of lives lost will permanently affect global economic growth in addition to the cost of rising levels of poverty, lives upended, careers derailed, and increased social unrest. Next, it also brings some effect to our daily lifestyle. The effects of this change are catastrophic, exposing senior citizens, cancer patients, renal dialysis, obesity, asthmatics, heart patients, chronic liver patients, diabetics, hypertension patients to a high-risk cohort. Strict social distancing steps, self-isolation, face masks, and working from home have all been the modern routine as a result of the pandemic. To mitigate the threats, most countries around the world have implemented a lockout and strict social distancing interventions. The lockdown measures have brought social distancing, work from home, telemedicine consultation, face masks being forced on us by coronavirus. Many of us have adjusted and got used to these radical lifestyle changes. Lastly, healthcare systems in Malaysia and around the world have borne the full brunt of COVID-19. The pandemic has upended normal operations, backlogging an estimated 28 million procedures, exposed system and supply chain limitations, tested the physical and mental limits of health workers and caused rapid adoption of digital solutions. According to our Malaysia's Prime Minister Tan Sri Muhyiddin Yassin, Malaysia's health system is close to reaching its breaking point following the increasing number of positive COVID-19 cases. COVID-19 hospitals, including the intensive care units, are nearing 100% capacity. Not only that, UMMC also utilized integrated information system to track and manage crucial supplies such as personal protective equipment, manage healthcare workers and tracing their movements to minimize risk, optimize patient care and ensure that relevant information is delivered effectively, maintain surveillance of disease clusters and tracking treatment plans of patients.